want to welcome you to our seminar on navigating Medicare. Medicare can be a very confusing thing for anyone. There are many parts to it, many regulations, and we're going to try in the seminar to remove some of the fog and help you navigate Medicare. Certainly as we do that, we can sometimes feel like dummies because it is complex. We won't be trying to hit every minute detail. We will be looking at the bigger aspects and hopefully helping to guide you towards making decisions. I do want to emphasize that decision making with Medicare is a very individual thing depending on some preferences and circumstances, but hopefully we'll give you a roadmap that will help you make those kind of decisions. What we're going to be talking about tonight, we'll review Medicare rules in general just to make sure we have the basics in mind. And then we'll take each part of Medicare. Part A, hospital. Part B, which is primarily doctors. Part C, your Medicare Advantage plans. Part D, the drug plans. And then also the Medicare Supplement plans, which is also known as Medigap. Now, you may already have your Medicare card, in which case it will tell you the effective date for Part A and Part B. If not, though, if you're thinking of signing up for Medicare or just want to review some of the rules and search for different types of drug plans, two good websites I want to recommend to everyone. One is simply medicare.gov, G-O-V, and under this website, in addition to general information, you can key in your current prescription drugs, and it will suggest various plans that might fit your needs. You can look at various types of supplement policies. It's a good general resource. This is also where you initially sign up for Medicare. In addition, the North Carolina Department of Insurance has good information on its website. The Seniors Health Insurance Information Program. It's not only information, it's a phone number that you can call. You can speak with someone at the department. You can actually make an appointment for a free consultation with some volunteers. Every county has some volunteers that participate in this, so that's also a resource I would certainly recommend to everyone. Now, signing up for Medicare, if you haven't already done it, of course, the magic day is your 65th birthday. So it becomes effective on the first of the month in which you're born. So if your birthday is March 20th, let's say, on March 1 of that same month when you turn 65 will be the effective date for Medicare. You can actually enroll up to 3 months before your birthday month and also up to 3 months after your birthday month, giving you effectively about a 7-month window. In addition to the initial enrollment, there is an open enrollment period every year. It runs from October 15th to December 7th. Obviously, it's coming up pretty soon now. And during that open enrollment period, you can look to change if you're in a Medicare Advantage plan and wanted to go back to original or traditional Medicare, you could do that, or vice versa. If you wanted to switch to an Advantage plan, you could also do that. So we're coming up on the open enrollment period. Now, again, Medicare has many deadlines to consider. It has various penalties in addition to the confusing A, B, C, D parts. You certainly don't want to miss the initial sign-up date because if you do, there will be a penalty that you'll pay on top of your premiums for Part B, and this penalty never really goes away. So definitely at the time you need to sign up, you do need to sign up. Now, on this next slide, this will kind of give you the roadmap of how we're going to be approaching this tonight. So on the left-hand side, under Medicare coverage choices, you'll see original Medicare, Part A and Part B. So we're going to focus on that first. And then right below that are optional things you can add to Medicare, a supplement policy or prescription drugs. So we'll then get into those two. And then on the right-hand side, really totally separate, because it is totally separate from original Medicare, will be the Medicare Advantage plans. And then we'll ultimately kind of contrast these two approaches, original versus Medicare Advantage. So original Medicare has a Part A and a Part B. Part A is your hospital part, which would also cover stays in the hospital, surgery, skilled nursing facility, lab test, etc. And if you look at Part A has various deductibles and copays. So if you're in the hospital, as you'll note, during days 1 through 60, you don't pay anything except for a $1,316 deductible. Note that deductible amount changes every single year, but that's the amount for 2017. The days 61, 90, which I hope certain you never see, and that'd be a long time in the hospital, but for days 61 through 90, there's a $329 a day copayment, which for 30 days would mount up to be $9,870 for 2017. Days 91 through 150, which includes what they refer to as lifetime reserve days if they're used, there's a $658 deductible, or copay rather, per day. And so there, that amount over 60 days would be $39,480 potentially, should you ever be subject to that. So these exposures under Part A are the very things, when we get over to your Medicare supplement policies, that are covered under supplement policies. That's why supplement policies exist, to cover some of these exposures. Okay. Also note that under skilled nursing confinement, you have to first have been an inpatient, having a hospital stay of at least 3 days in either a Medicare approved skilled nursing facility or just a regular hospital before receiving the skilled nursing care. So that's an important gatekeeping function to be aware of, that'll determine whether or not your skilled nursing confinement is even covered. Also note, this is skilled nursing. This is not long-term care. Medicare Part A is really not designed for long-term care, which is more custodial in nature. This is skilled nursing care, very different. Okay, on the next slide, we move over to Medicare Part B. And if you'll note on this chart, Part B now is for doctors primarily, physician services, outpatient care, test. So there is an annual deductible of $183. Again, this changes every year, so a fairly modest deductible that you pay. After that, primarily Medicare will pick up 80% of the Medicare approved amount, leaving you with 20% of the Medicare approved amount. In addition, you could have some exposure beyond that, though, because some doctors who may accept Medicare assignment do have the ability to tack on up to an additional 15%, which would fall on the user to pay. And so one thing to be aware of as you talk to your physicians is just whether or not they fully accept the Medicare payment, or whether they do tack on that variable component. But again, this 20% exposure to what is not covered by Medicare Part B is what is looked for in the supplement policies. So on the next slide, let's just understand also that Parts A and B, there are several things they do not cover. I've already mentioned long-term nursing care. You get beyond 100 days of skilled, and there's really no coverage. Some routine things, cosmetic surgery, acupuncture normally, things of that nature are usually not covered by Parts A and B. Neither is care outside the United States. So foreign travel, something you have to keep in mind. Again, we'll see that this is usually covered in some of the supplement policies. Now, Part A does not cost anything with Medicare. If you qualify, you get Part A, the hospital part. Part B, on the other hand, you do pay for. There are annual, or actually rather monthly premiums that come out of your Social Security check. And so if we look at this chart, you'll see on the column to the far right that the standard amount in 2017 is $134. Now, if you've been getting Social Security for a while, you may not be paying quite that amount in 2017. You may have a somewhat smaller amount. I think it's around $109. And that's simply because for those already on Social Security, if the annual increase, inflationary increase in Social Security is less than the potential increase in the Part B premiums, you only go up as much percentage-wise as the Part B premium goes up. So for someone brand new coming into Medicare who's not yet claiming Social Security, this would be their starting premium at $134. However, let's note that it could be higher. If your income exceeds on a joint tax return $170,000, so if it fell into that category of 170 up to 214,000, instead of paying $134, you're paying $187.50 per month. Also note this is a per spouse, not a joint payment. And it continues rising if income is higher. Also note this is based on your 2015 year tax return, but it's affecting your 2017 year Medicare Part D premium, and that's simply because it takes time for returns to be filed and processed and for that number to be available. But just keep in mind you may be paying more. And if you're not claiming Social Security, if you're simply on Medicare but you've delayed your Social Security, and you make this payment directly. If you are claiming Social Security benefits, then this will come out of your monthly Social Security check. Okay, that's Part A and Part B. We saw there are some exposures on the hospital in terms of deductibles and copay. There's also exposure on doctor costs, the 20% that's not covered. And so now we're going to move over from those from original Medicare and look on this next chart down at the bottom left where it says Medicare Supplement Insurance, Medigap. So Medigap, there is a gap. That's the gap that's not covered for Part A and Part B. And when you look at Medigap policies, there's a confusing number of plan types. A, B, C, D, F, G, K. It's an alphabet soup of plan types. Now, first of all, don't get confused by these letters and the Medicare letters. Medicare Part A, Medicare Part B, that's not the same thing as these. This is strictly a nomenclature for Medigap policies. And if you'll note on this chart, what these policies in general all try to cover is either all of the Medicare Part A either deductible or the co-insurance, the amounts you pay per day in hospitals, or the 20% that's not covered by Part B. They're either paying that in full or paying it at 50% or 75%. They may or may not be covering some aspects of skilled nursing, but many of these policies cover most of the exposures under Part A and B. Now, if you look under Part F, or the Plan F under Medigap, I'm going to focus on that one simply because it's probably one of the more complete ones. If you look down that column, it's 100% on everything except the very bottom part, which is foreign travel, in which it does cover foreign travel, but only up to 80%. Plan F is a fairly complete plan, and if you'll look at the next slide, you'll also know that Plan F is the most popular plan under the Medigap plans, with 57% of people buying Medigap policies buying a Plan F. However, Plan F itself, there are two different versions of Plan F. There's a regular version as well as a high deductible version, and this 57% actually encompasses both versions. I don't know how it breaks out between those two. But Plan F being the most popular, and then followed, as you can see, by G, C, and N, roughly the same size. So again, Plan F is popular because it simply covers most of the exposures. I did want to contrast, interestingly, just Plan F, not the high deductible version, the normal version, Plan F versus Plan G, because they essentially are the same plan, except the only thing, if you'll note on Plan G, that it does not cover is the Part B deductible, but that's only $183 a year benefit to begin with. And in some cases, you find that buying Plan G, the premium is, you save more on the premium than what it's costing you on the $183. I looked at one version where if I got Plan G, the premium on an annual basis was about $360 less than the Plan F premium. And the only thing I lost by going to Plan G was $183 a year benefit of covering the Part B deductible, making Plan G the better choice. And so as you choose these plans, you really have to sit down and look at your budget, look at what you want it to cover, what you think your exposure is going to be in Plan A and Plan B, and choose accordingly. Now, moving over from the Medigap policies, we're going to take a look at the prescription drug coverage. This is Medicare Part D. And similar to the Part D, if your income exceeds a certain level, you may pay some additional money. So with Part D, you pay a premium to an insurance company. If your income on your tax return, joint tax return, was less than $170,000, you only pay the premium to the insurance company. If the income was more than that, in addition to the premium, you'll note on this slide where, let's say the income was in the 170 to 214 range on a joint return, in addition to the plan premium, you pay $13.30 per month, which would again come out of your Social Security check. So there's no separate Part D premium like there is on Part B with Medicare, but there could be an adjustment where they do add an additional cost on your that comes out of your Social Security check. Now, what does Plan D cost? Well, the next slide takes a look nationally at some average monthly premiums. And these are some of the large plans with the highest enrollment, national average being about $42 a month. But as you can see, it ranges from $16.81 up to $71.60. If you're wondering why there's such a wide variation, these plans can have different components or different amounts of coverage. There's a certain basic amount they will cover, but some plans will add some additional coverage, but then you pay for that additional coverage. And so one of the keys with these plans is understanding what drugs you're taking, the frequency of taking them, and then which plans cover those drugs and at what price. And that'll kind of lead you to making some decisions. One thing, if you go to that North Carolina Department of Insurance website, they have a list you can get there of companies offering Medigap policies in North Carolina, as well as the Plan D drug plans in North Carolina. So that'll give you a starting point to know all the companies that are available. Now, the next slide begins looking on the Medicare Part D at some of the phases and what it will cost you. And this is where if you already have these kinds of plans, you may be aware of the expression donut hole, which simply refers to the fact that somewhere during the year, as your medical costs mount up, the amount that you may have to pay increases quite a bit, like falling into a hole. And so this first slide, as you'll note on the left, says that there's an initial $400 deductible that you pay. So the first $400 of drug cost is totally out of your pocket. Then until you get up to $3,700 in drug cost, which includes that $400 initially, in that range, you're paying 25% of the cost, so 75% is being picked up by the plan. But then it gets worse, and this is the donut hole, this gap period, in which you are now paying 40% of the brand name retail price for some drugs, but if you get the generic version, it's even higher. You may be paying 51%, presumably a lesser cost on generic though. And you continue in that fashion until you have actually spent out of your own pocket $4,950 in total. Now, the next slide, which has similar information, entitled Standard Medicare Prescription Drug Benefit, but it will also, it's a different layout, but up in the upper right-hand corner, you can see where they also estimate about how much it takes in total drug costs to get through the initial coverage, through the donut hole, and to the point where the plan is now paying almost everything, the plan and Medicare, and you're only having to pay about 5%. The estimate is $8,071. Is about what it would take in total drug costs during a year to get to that point. So some people never get to the donut hole. Some people are in it but never get out of it. If you have a very high amount of drug costs, you may get totally through it. The donut hole itself is closing. These numbers change every year. So by 2020, there will not be any difference between what is paid for brand name versus generic drugs. And so by 2020, it's a 25% payment by you, 75% that's being picked up by the plan or the government. Now, that's Medicare Supplement, that's Part D. And so what I want to shift to now is the Medicare Advantage. And if you think about it, like going down the highway, it is taking an off-ramp. Medicare Advantage is moving from the Medicare system into a private payment. So Medicare Advantage are private companies who are offering policies according to governmental rules. So this next slide simply compares Medicare supplements to Medicare Advantage. Under the Medicare supplement, you can really see any doctor who accepts Medicare. And whereas under the Medicare Advantage, you are limited. You're either having to see the doctors just in the HMO network, or if you're in a PPO, you may go to an out-of-network doctor with a PPO, but it will cost you more money. So you do have more restrictions with Medicare Advantage. Medicare supplements, you don't really have a copay, whereas with Medicare Advantage, you do. So this is typically where you go to see the doctor and you pay $25 or $50 as a copay. Very similar to what you may have had before you retired under some kind of group health plan. Neither one may have deductibles. You don't have an out-of-pocket concept with supplements. You do with Advantage. So as these payments mount up, these copay amounts for doctors or for other services, at some point you've paid a substantial amount out of pocket, and once you hit that level, now you don't pay any more, and the plan really picks up everything. But that level usually is several $1,000s. So you'll be paying that for quite a while, and then once you hit that level, though, then you're out of it. With Medicare supplements, you do have to add a prescription drug plan. It's separate from the supplement itself. Whereas with Medicare Advantage, most Advantage plans will include a prescription drug plan. They don't have to, but most will. So how do you make a decision here between the two? Well, again, it's facts and circumstances. It's your own situation, kind of how you like to budget too. Medicare supplement plans allow you to see any doctor, so that's very important to you. You're naturally going to like a supplement more. It doesn't have copays. You don't need a referral to see a specialist with Medicare supplement plans. Since your drug plan is separate from your Medigap policy, you could keep your Medigap and change your drug plan if you wanted to. You don't have that choice with Medicare Advantage because it's bundled. The Medicare supplement plus a drug plan could be more expensive than Medicare Advantage, so that's one reason people go to Medicare Advantage. But if you heavily use the Medicare Advantage, racking up these co-payments, at some point, the amount you pay with all these co-payments until you hit your out-of-pocket, you're going to be seeing actually more costs with the Medicare Advantage. So it's facts and circumstances. On the other hand, why would people use the Medicare Advantage? Well, initially it is lower premium. So you may say, hey, I just think I'm going to pay less. I don't think I'll rack up that much in drug bills. The Advantage plan may also package in some extra benefits like some vision or care or dental care. That sounds attractive. You may decide you can live with the restriction on doctors. That doesn't matter too much to you. But just keep it. And one final thing, I think, it's one policy. So with traditional Medicare plus a supplement plus a drug plan, you're juggling three policies. With Medicare Advantage, it's one simple policy that sort of looks and feels like your group health plan may have before you retired, and that simply attracts certain people. I would suggest make sure you check with your physicians, though, to make sure that they accept Medicare Advantage. You may find they accept traditional Medicare with a supplement, but do not accept Medicare Advantage. So that's a key consideration, I think. Now, how significant are Medicare Advantage versus traditional? You can see on this next chart, traditional Medicare accounts for 69% of the Medicare plans, Medicare Advantage about 31%, and 2/3 of the Medicare Advantage plans are the HMO types. So they certainly dominate the landscape in terms of types. Now, Can you make changes? Let's look at some time frames here that are kind of important. When you initially enroll, so for the first 6 months after age 65, you have guaranteed acceptance. You want to go to a Medigap plan, there's no health questions, they're going to accept you. You can change a Medigap plan, Medicare Supplement plans, anytime during a year, but that may be subject to medical underwriting. So a plan that at that point would not necessarily have to accept you, or they could accept you, and there could be a waiting period on some pre-existing conditions. You could also move during the open enrollment period, this October 15th to December 7th period, from traditional Medicare with a Medigap plan to a Medicare Advantage plan. And if you do that movement, that's guaranteed acceptance there. On the other hand, suppose you want to move back. Suppose you went to the Medicare Advantage and said, you know, I really don't like this thing. I want to go back to Medigap. Well, during like the first year, right after 65, there are some, you have the ability within certain very limited time frames to do that with no harm, no foul, no problem. But suppose it's been several years and you just decided, I'm using this Medicare Advantage more heavily. I don't like the copays. I think I want to go back to traditional Medicare. Well, you can go back to traditional Medicare. The question is, can I get a Medigap policy to cover what Medicare doesn't cover? And the answer is yes, subject to medical underwriting. So you may find that you don't qualify for a Medigap policy, or you qualify, but they've put on some type of waiting period for some pre-existing conditions. So, you know, before you move back, you want to make sure you can be accepted. Otherwise, you're going to be wanting to stay with your Medicare Advantage. So you may be, in a sense, kind of trapped in that case. Interestingly, some companies do allow that. So you've got federal law, but you also have the way certain corporations handle it. So Blue Cross, for example, does allow moving back and forth annually between their Medigap and Medicare Advantage plans with no underwriting. So you may check, if you're looking at other companies, they may have a similar type of arrangement, or they may not. And so that's something worth checking. Finally, just to give you some thoughts about how you do kind of view these things, I did a quick cost comparison. In this case, just using Blue Cross, because I had the data handy, using someone age 65, and just comparing what it would cost traditional, which is original Medicare, versus Medicare Advantage. So if you note, Medicare Part A, well, under either one, you don't pay anything. Medicare Part D is $134 a month, and whether you are in traditional Medicare or Medicare Advantage, you will pay that. That does not change, so you continue making a Part B payment. Under traditional, if you get a Medigap plan, and in this case I used Plan G, the cost was $122 a month. The Part D drug plan, many plans to choose from, but there's some out there acceptable, I think, for around $30 a month. But under the Medicare Advantage, if you note the Part C, again, this is Blue Cross's number at this age, is $86. So the monthly premium, as you tally them up, are $286 traditional, $220 Medicare Advantage, working out to $3,432 traditional, $2,640 Advantage. So clearly there's about an $800 a year savings in premium cost with Advantage. On the other hand, with Advantage, you have copays. So you're seeing $25, let's say, to see your physician, or $50 on a specialist, and other types of copays beyond that, that will start chipping away at that $800 a year cost savings. At some point, if you pay enough of that, and that point, the out-of-pocket maximum in this particular plan was $5,500, that'd be an awful lot of doctor visits. But if you ever hit that level, then the plan's picking up everything. But if you continue making these copays and chipping away at that $800 differential, it wouldn't take too long before it's almost a toss-up between the cost of the two plans. But this, to me, is a kind of analysis that each person has to do based on the companies, based on their age, based on whether they're trying to go for a high deductible Medigap or traditional. There's just no substitute to go through this type of analysis. So I hope you got some good thoughts from this. Again, you've got the October 15th open enrollment coming up. Don't let that slide by. Do your homework. If you have some questions, give us a call. I'd also encourage you, if you at the state level, through the Department of Insurance, that Seniors Health Insurance Program, they have a toll-free number and some helpful folks there for some good general questions. Otherwise, thank you for listening. Hope you have a pleasant evening.